Hi everyone, my name is Beth O'Riordan and I lead commercial content marketing here at Best Buy Health. Thanks so much for joining today's webinar. Um, the Best Buy Health Broker Referral Program, Best Practices for Engaging Clients and Driving Referrals. Today you're going to hear from Scott Hartlieb, who's the Director of Health Plan Sales here at Best Buy Health, before he hands things over to Brandon McCool, who's the Associate Director of Health Retail Partnership and Sales at Best Buy Health. Scott's going to give a brief overview of the program, including our current June promotion. And then Brandon is going to hit on some best practices for driving client conversations around PERS. We're going to end today's session with a Q&A, so please feel free to submit questions into that Q&A box on your screen. We've scheduled just 15 minutes for today, knowing that you're all busy. It's a beautiful summer day. There's a lot going on. However, we will stay and answer as many questions as we can at the end. We'll also be recording today's webinar, and we will be distributing that recording in the next few days. And then lastly, there is a post-webinar survey at the end. We always appreciate feedback. We find it incredibly valuable, so please take a few moments to fill out that. That would be great for us. And with that, I'm going to hand things over to Scott.
Thanks so much, Beth, and thanks to everyone for joining. Our journey with this program really started about a year ago when brokers were coming to us and saying they had members who were going to lose their personal emergency response device because their carriers were dropping it as a supplemental benefit. And they were coming to Best Buy Health as one of the leaders in the personal emergency response space and asking, was there any way that we could help out? How could we help them? How could we help their members? And it was really through that direct feedback and those direct questions to us that we launched this broker referral program. So at a high level, the program allows you to refer your members to our industry leading personal emergency response service. And in doing so, the member receives a 50% discount on the device, and you earn a $25 commission for each member that signs up for the service. It's really that simple, that easy. We handle everything from there. We handle the device fulfillment, delivery, setup, and ongoing support for the program. I know some of you are already signed up for the program, but for those who aren't, I wanted to quickly walk through the process. We'll include a link and an email following the session with all of this information. So the link will be available to you. And when you use that link, it'll take you to the screen on the left-hand side of the slide. It'll ask for a few pieces of information to create your account. And once your account is created, you'll have access to all the tools and information you need. Once you create the account, the portal will take you to the right-hand side, and that is your personal dashboard. The most important thing on your dashboard is that referral link. That is the link that must be used by the member to order their PERS. In using that link, that will automatically populate the 50% off discount code, as well as attribute the sale back to you for commission tracking. Within that dashboard as well, you'll see a tab highlighted in red called Marketing Tools. That's where you'll find the various resources that are helpful to you during the sales process, including a Getting Started guide, an FAQs document, a member flyer, and a sample email template for you to use with your members. I will call out and ask that you pay particular attention to the FAQs document. We put a lot of thought into that document and actually built it through questions that we got from brokers who are already registered in the program. We want to make sure that you are comfortable and confident with the service, with the Best Buy Health PERS program. So when you're speaking to your members, you have all the information you need. And then finally, I wanted to share an exciting promotion we have going on in June. So we're offering an additional bonus payout on top of the standard $25 per sale if you achieve the targets listed on the slide. So in the month of June, any sales that you have will be counted towards your bonus payout, and we'll be paying those out after the month closes. In addition to this bonus program and the standard $25, we also have at the agency level an override structure. So if you are an agency owner, please reach out to me directly, and I can get you more information about the override process. So now that we've gone through the housekeeping, I wanted to shift a little bit and talk about how to have the conversation with members about personal emergency response. And I'll be the first one to admit, at many times it's not an easy conversation, but it is a very, very important one. So I'm going to hand it over to my colleague Brandon, who's going to share with you some best practices when engaging your clients about PERS.
Scott. So I'm excited to be here today just to spend a little bit of time with you around some of the scenarios and the conversations that will come up when you're selling this device. So as we go to the next slide, we can highlight some of the personal recommendations. But before we start, I want, if you're driving, please don't write them down, but as you're driving, think about it. If you're at your desk, write these two scenarios down. As we look at this customer, there's a proactive and a reactive customer. And I think that's important that we put that in our mindset as we're having these conversations. So we'll start with the reactive customer for these devices. And that's kind of a recent incident that has occurred, a fall or injury. And maybe it's even a physician appointment that, based off of some of the new prescriptions and medications that the physician has prescribed to this customer, they might have some weakness, some poor strength, and some risk of falling. And there's a reactive stage that goes into that customer need, and we have to understand what they're going through. And then there's a proactive customer as well. Now, this proactive customer is today you're probably talking to the end user. But sometimes the conversation might lead to the caregiver. As Scott mentioned, this is a hard conversation to have to make sure that we get the right device for this customer to really prevent the safety in their home. And then the other big thing that we hear a lot of times is agent in place and peace of mind for the family. So I want to make sure that we have that in context as we go through the next two slides to kind of understand there's two scenarios, one being proactive, one being reactive. But let's be honest, you guys would know your customers, their life and their journey of where they stand when it comes to these conversations. And that's when we get into these three benefits that I think that we hear a lot about when we do discuss with the benefits of the live and mobile device. And as you think about these guided conversations, like I mentioned before, it might involve the caregiver. I think sometimes like the end user, you have to think about like, why am I buying this device? Why is the need? Why these certain things are needed? And then the caregiver, it's a peace of mind that they want as well. So we'll start with the 24/7 emergency support. We have to highlight it. The reason why it's there is because of the falls, right? There's this stigma that this 1 in 4 go to a fall, and 65 plus, from anywhere from prescriptions, from anywhere from aging in place, from also being at home alone. That's just one element and benefit of this device. Two, it's a mental health. When you think about mental health with this demographic, you think about loneliness. There's times that they're lonely, they need someone to talk to. By a push of the button, they can just talk to one of our agents at any given time. There's also anxiety that takes place. They need somebody to talk to. There's sometimes that they don't have clients that they can talk to, or they don't have people to talk to at certain times when they're having anxiety. And then there's safety that tied to this emergency support. Safety is they're lost, they don't know where they're at. We're here to support that. And there's also we hear all the time that they use it for notifying emergency police, EMS, things of that nature as well. when they're running into certain things that we can connect. That's one key point around Lively Mobile too. The second is link app, and I think this is where a lot of times when you think about a link app regarding like, hey, the caregiver on the other side, like there's reasons why the link app is so important and it's a benefit of solution for this customer, is that there's times that you can find out where the location of this customer is by having the PERS on the customer. Two, we know the battery life. So what is the battery life? Why it's so important? You got to think about like we want to make sure it's charged, it's there, it's 100% usable when the customer does have it on. And you can see that through this link app, making sure that one, mom or dad or your loved one has charged this overnight and it's 100%. And then the other thing I think is really important is like you want to have a conversation with your loved one, your mom and dad. You don't want to call and say, "Hey, did you get up? Did you fall? Tell me about your day." You want to have the real life conversations around, what's going on in family life, what's going on with the kids, what's going on with grandkids, things of that nature. This link app allows customers, really the caregiver, to understand how many times the urgent response was notified. It notifies family members when it's been activated. What was the end result of after it has been triggered and pushed, and what kind of conversations have happened. I think that's very important. And it kind of brings the value of the peace of mind that we also talk about. And peace of mind is like, I'll go back to Scott saying this is a hard conversation, but peace of mind is what we're trying to solve for this customer. And the peace of mind, the value of this is having the support to customer, also the honestly, it's the family, like the family being involved in like everyone's safe, the urgent needs there, the safety, the well-being, and we're providing support for aging in place. So as you're thinking about the conversations, your clients' journeys, like exactly where they fall from when it comes to this personalized recommendation. But I also understand there's hard decisions that have to be made when these decisions are and these conversations are taking place. As we go to the next and we think about the overcoming objections, when we think about this piece of it, we think about the opportunity for admitting defeat, independence taken away when you have to purchase this device. So can we slide to the next? There you go. Perfect. So as we look at guiding the conversation, I think it's important that we think about one, we have to make the connection. Why are we having this conversation? Why is this taking place? What is the safety? What is the well-being? What's the peace of mind that we're trying to take care of our customers for? And what recently happened that they are interested in talking about a PERS device? I think the other piece that we have to provide is the viewpoint. There's a different viewpoint that I don't think we talk about, and it's the conversation that you're having when you do purchase a personal emergency response device. All of us on this call at one point will become our parents' parent, and we have to understand that, like, we also want to be the kid of the parent. And what I mean by that is you're going to have to bring sometimes a caregiver in to make the conversation around, hey, mom and dad, I want to make sure that we understand that the need of this is for your safety and well-being, but it also allows us to have normal conversations. And I touched a little bit about it on the slide before, but to make a viewpoint and consider raising the proactive approach to this customer is true to make sure they understand why we're doing it. There's always the why behind it, but it allows the son, the daughter, the caregiver to become the caregiver, the son and daughter again by allowing them to have personal conversations instead of medical and health conversations on a daily basis. I think the other piece that we have to think about is highlighting the why around, like, what does it mean for this customer? Why is it important? Why are we currently doing this? It's because we want to age in place and have a peace of mind. It's not only for the end user, but it's also for the caregiver and the family members. It's very important that we highlight the why. You start with the objections. There's a reason why that they're either reaching out to you, or you as the you talking to the customer about this. Like, you guys know the life of the journey of this customer, so you want to understand, like, hey, I'm offering you a solution to give everyone a peace of mind, but also aging in place, and there has to be a why behind it. And it allows us to ensure the safety and have a proactive approach. So when events happen, when falls happen, when things that, are out of our control, anxiety hits, loneliness, mental health, we're here to help you, and just tell them the why behind it, because it's a bigger picture than just saying, hey, you need this because of X, Y, and Z. But there's a bigger why, and there's emotional tie to every time we sell these devices. You're saving someone's life. Like everyone on this call, when you sell this device, you're helping someone age in place, but also at the same time have a better life at home by having a device that provides a solution. So it's always highlighting the why. So I appreciate the conversation today, and I'll hand it back over to Scott.
Thanks, Brandon. I've been trying to work through some of the questions in the chat. I'll just address some of them that I've seen. I know I've answered some, but I'll address some of them. It is a out-of-pocket offering. So the reason why we launched this is that many of the carriers who used to cover it have dropped it as a supplemental benefit and no longer carry it. So it's in many cases it is not available as a covered supplemental benefit within MA plans. If your member is in a plan, I know the Anthem plans and WellPoint plans still do cover it. Many of them do. Certainly go down that route. If it's available in their plan as a supplemental benefit and they can get it for free, obviously go down that route. For everyone else, which is the majority of the MA population, it is not covered. And this is an opportunity for you to offer your members a discount on the device and then earn commission as well. So it is a cash pay out of pocket for the member. Question around doctor's prescription. There typically is not well, for this program, there certainly is not a doctor's prescription. With many of the plans, if it is a supplemental benefit, in most cases it's not required. It's just if you're eligible, you can take advantage of it. The form factor, so you'll see the pendant is the device that's available today. That's what's pictured on the screen. The pendant has the most accurate fall detection. So our fall detection, we have a proprietary algorithm that we have built in-house with our PhD level data scientists. It is most accurate in the pendant form factor. We are launching a smartwatch next year that will be available, but today the form factor is the pendant because we find that has the most accurate fall detection. How much does it weigh? We have the specs available, I believe, in the FAQs. I have one at my desk. It is very light in the ounces. Is it a phone line needed Wi-Fi? It does not. It has it does not need Wi-Fi. It has its own cellular chip inside the device itself. So it works off of the Verizon network. So anywhere where there is Verizon coverage, the device will work based off of the cell signal that it picks up. There's a speaker and a microphone on the device itself. So you talk and communicate right through the device, and it cellularly connects to our caring centers. The calls go to our Best Buy Health caring centers. We have 3 of them in the United States, staffed by live human beings. So within a matter of, on average, 2 seconds, a member will be connected to a live human being who's a W-2 Best Buy Health employee. They're going to help triage the situation to determine what the best course of action is. Only less than 5% of those situations result in emergency dispatch. Most of them we're able to resolve in-house. They could range from somebody that fell down that needs help getting up, and we can contact a neighbor or a loved one, all the way to our most common call actually is people that are just lonely and want to talk to a live human being because they're socially isolated. And we support all those calls and everything in between. It's not just for emergencies. Working through the questions. Right now, PayPal is the only form of commission compensation today.
Scott, there's a question to just revisit the 50% discount information. Could you just go over that briefly?
Sure. What was the question again?
Yeah, it just says please revisit the
Oh, okay, the
50%.
50. So the 50% discount is available if the member or if you're working with a caregiver, if they sign up and purchase through your link. So I mentioned that referral link. That's that's what you want to provide to your members or to the caregivers. And once they click on that link, it will automatically populate the 50% discount code. So they don't have to type in any code, or they don't have to type in anything. If they use your link, the 50% off will be applied automatically in their cart.
And there's another question. Is there an option to reach out to family members only and not emergency services? So if there's something non-emergency, if someone falls and like isn't significantly hurt, can it do
Yeah,
that?
so our team, so the team that answers the calls, they're trained the same way as a 911 operator is trained, and they will determine what the best course of action is. If they deem that it truly is a urgent medical emergency, then we will go that route. If it is not, and we're talking to the member, and for example, we get a lot of calls where members have fallen and they are unable to get up, and they just would like us to call their family member or call their neighbor, we will absolutely do that. So we are in coordination with the member who's speaking to us, and we're listening to that conversation through the device, and in coordination with that member, determining what the next action will be.
Okay.
There's a question around the fall detection. So the fall detection is trained to go off when a fall has occurred. So setting it down on the table typically will not trigger the fall detection to go off. There's a question about clients in a rural area. The coverage area, if there is a Verizon signal in the area, the device will work. Depending on how rural it is, if the device is unable to get a Verizon signal, then it's not going to be effective. The device also has GPS in it, so it can be taken anywhere. It's called a mobile unit for a reason. So it's mobile. The member can wear it in the home, outside the home, on a walk, on a vacation on the other side of the country. And based off of the GPS, if the member needs help, we know where that member is based off of the device's location. So if the person is out on a walk and they need emergency services, we're not sending those services to their house. We're sending them to where they are based off the GPS location.
Scott, there are a few questions just around what's available to them to help market this product to their clients. Can you just review again? I know we had it on screen, the marketing materials.
Yeah, if you want to go back to that slide. So within the portal, when you sign up, you'll have access to the marketing tools tab. Within that tab, there's a lot of helpful information. I mentioned there is the getting started guide. So that's more geared towards you, to walk you through the elements of the program. The FAQs is meant for you as the broker to read through, to educate yourself about the service, about how the service works, what the device is, how does there's information around pricing. So how does our pricing compare to other PERS in the market? Spoiler alert, it's the best price in the market compared to what competitors are offering. We also, there's information about the fact that it's a no contract service. So many of the other competitors force members into signing up for a year-long commitment or a 2-year-long commitment. This is a month-to-month service where members can cancel at any time. So the FAQs, I encourage you to read through the FAQs. The intent is to empower you with all the information you're going to need when talking to your clients. The member-facing flyer is just as it says. So this is something that provides a high-level overview of the service. This can be shared directly with your clients and members. And then the email and social posts, those are kind of pre-written text that you can feel free to leverage when you are sending this out to your members or posting it on social media. We also have included the Best Buy Health logos. So if you want to use those logos in any of your materials or posts, feel free to use those approved logos as well.
And just while we're talking about marketing materials, I just want to highlight something that's coming very soon to everyone that's registered for the program. And we will be sending you assets to help you wish your clients a happy 4th of July. It will include a postcard, a letter, an email, all customizable with your headshot, phone number, contact information. So that should be hitting your inbox, if not today, then tomorrow. Just another way to share the information with your clients, but also wish them a happy holiday.
I know we have still a couple more minutes. There was a question around the service cost. So the cost of the device is $80. The 50% off will knock that down to $40. The 50% off code is off of whatever price the device is at this time. So currently the reg price is $80, so you get 50% off of that. Occasionally throughout the year, we'll run sales and the device may be on sale for $70. In that case, you would get 50% off the $70. So it's 50% off whatever the price of the device is at that time. The monthly service starts at $24.99. That $24.99 service is our most popular service. So there's no kind of add-on gotchas. The additional upgrades on top of the $24.99 would be a $10 upgrade to add on fall detection. So that's something that we see commonly added on. And then for an additional $10, there's a nurse line that can be added on as well. We make that available to members who may need access to a nurse line. But the $24.99 option is our most commonly subscribed offering. And that, again, in the FAQs, you'll see how that compares to the competitors in the space and where they're at for their monthly prices.
There's a question around, can a person pick up the device at a local Best Buy store?
The delivery options may include picking it up at the store. Most people elect to have it shipped. The members cannot get the discount and you cannot get the credit if the member purchases through the store or calls in, for that matter. The referral link is the only way it's going to auto apply the discount and track the commission to be paid back to you. So the referral link is the only way that we can track that. So that is the way that we recommend the members purchasing it through. That is when you click on the link, and you can test it yourself. When you click on the link, that will then take the member to the sign up page that will allow them to purchase and sign up for the service right on that page. So that'll allow them to transact through the link itself.
Scott, another question I saw come in is will it locate a person in case the person who hit the button is not reachable?
Yes. So the GPS is available to locate somebody that's not reachable. We have protocols in place. If we get a call into our caring center and we start speaking through the device and we don't hear any response, we go through our protocols, because it could be somebody that had a fall or is incapacitated, and we will go through our protocols to get them the help they need. So we have steps in place based off of an unresponsive call.
And does the client have to have a lanyard that comes with the item?
The item comes with a lanyard. So the lanyard is an accessory that comes standard with the device. I see a question about PayPal. PayPal is how you, as a broker, get paid your commission. The member can purchase it through the website using credit card is the typical way that they pay. But you, as a broker, are paid your commission via PayPal.
There was an ask just to flash up the bonus structure again for June, so that's what's on the screen now. There was another question, can we put our referral link in the flyer for the client to access?
Yes, we can, Beth. If you could, we can work on getting you a customizable a flyer template to put your specific link on there. Or you can also, within the portal, there's a way you can, if you go back to the sign up page, Beth, real quick.
Right here.
So you can see there's the referral link. Below that, there actually is a button to create a QR code. So that's another way you can make your link available. It'll automatically create a QR code that's specific to your link, and that QR code can be you can put that on whatever piece of collateral you want. But we'll take a note and make sure that we get you kind of editable collateral that you can put your specific referral link or QR code onto. Can you market on a social media platforms and websites? Absolutely. You can market it to whoever and however you want it. There was a question around, is it only eligible, are brokers the only one that can sign up for it? That is true today. Brokers are who this program is geared towards. It doesn't have to be just Medicare Advantage brokers. You can be any type of insurance broker and be eligible to sign up for this program. Your members who you're talking to this to, they don't have to be your insurance clients. They can be friends, family, loved ones, anybody within your circle can take advantage of this offer. Chargebacks. There's a question about chargebacks. There are no chargebacks. So as I mentioned, it is a month-to-month service, so we don't have long contracts that we lock people into. If your member signs up and then cancels a month later, we're not charging back or clawing back the commission. As soon as the member signs up, your commission is paid, and there's no chargebacks. And again, I mentioned, if you own your own agency or are part of an agency that you think would be this would be something that they'd be interested in doing at the agency level, we do have an override structure in place. Feel free to reach out to me and I can walk you through how the agency override works.
Great. I think we got to most questions. If we did miss your question, we will certainly follow up in the next few days to get that answered for you. Thank you everyone for joining. Like I mentioned in the beginning, we're going to send out the recording. We'll send out, if you're already registered for the program, you have access to the FAQs and all of those other assets that Scott presented. If you're not registered, we're going to send out a link to help you register with the recording. So please look out for that. Scott, do you have any parting words before we end things out here?
I just want to thank everyone for what you do to support your clients. You really are on the front lines in helping your clients live safe and independent lives, and we appreciate your support. in this program. And any questions that you have, please reach out to me directly, and I can get you the information you need and support you in any way possible. Thank you so much.
Thanks, everyone.